Did you know that over 10% of the world's population is affected by chronic kidney disease, often without knowing it? Today, let's uncover the most common renal pathologies and how early detection can save lives. Join me. Hello and welcome. Today we'll look at renal pathologies, the common renal pathologies. We'll begin with renal calculus or renal stone, otherwise called urolithiasis or nephrolithiasis. Renal stone or urolithiasis is most common in men from age 20 to 40. Stone formation may be idiopathic, of unknown cause. Could be associated with stasis of urine. Stasis also predisposes the patient to infection. Prolonged ingestion of stone-forming substances. Chronic urinary tract infection can cause stone formation. Climatic conditions that are associated with dehydration. Clinical features for urolithiasis or urinary stone include patients may be clinically asymptomatic. The patient may be with flank pain, hematuria, that is blood in the urine when you look at it microscopically or grossly. Renal colic. Stone can occur in any part of the urinary system, but most commonly in the kidney, the renal cortex, medulla, vessels, calyces, or renal pelvis. These are the common areas. Most calculi arise in the collecting system. The ultrasound features would include calculi are seen as highly echogenic structures, regardless of the chemical composition. You will detect posterior acoustic shadowing depending on the stone size. It also depends on the transducer frequency and the focal zone. Tiny calculi will not shadow if they are smaller than the focal zone. Let's look at collecting system stones. The reflectivity of stones in renal sinus may be equal to that of the renal sinus itself. Therefore, sometimes it's difficult to distinguish the stone in the renal sinus. If the patient is scanned in a hydrated condition, the fluid in the sinus outlines the calculus and enables better visualization of the calculus versus the echogenic renal sinus. A staghorn calculus is a stone that completely fills the entire collecting system. That's to say, the pelvis and the calyces. It is usually associated with chronic infection and obstruction. Sonographically, staghorn calculus appear as a curved echogenic structure in the renal sinus area with posterior acoustic shadowing, which often hides any associated hydronephrosis. The pitfall for these, the false positive diagnosis occurs when other structures are mistaken for calculi. These structures can be arterial calcification, gas bubbles, small echogenic masses, milk of calcium in a small calycia or renal parenchymal cyst, and papillary necrosis. Now, nephrocalcinosis. This is the formation of calcium deposits in the renal parenchyma, a process that can impair kidney function. Nephrocalcinosis may eventually result in an acute obstructive uropathy or chronic obstructive uropathy, leading to eventual kidney failure. The disorder is often discovered when symptoms of renal insufficiency or renal failure, obstructive uropathy, or urinary tract stones are developed. That's when you begin to discover symptoms. Calcium salt deposition occurs most commonly in the medullary pyramid. May also occur in the renal cortex, either alone or in conjunction with the medullary deposits. Cortical nephrocarcinosis. Sonographically, cortical nephrocarcinosis is seen as increase in cortical echogenicity, which may be associated with acoustic shadowing. It is usually diffuse and bilateral. The causes will include chronic hypercalcemic states, acute cortical necrosis, chronic glomerulonephritis, ethylene glycol poisoning, rejected renal transplant. Whereas in medullary nephrocarcinosis, the sonographic appearance of these is usually seen diffusely throughout the kidney. The renal pyramids appear more echogenic than the adjacent cortex. The hyperechogenic region may be seen throughout the entire renal pyramid, or they may be seen only at the periphery of the pyramid or even at the tips. With time, further calcium deposit and stone formation will occur. Posterior acoustic shadowing is not associated with medullary nephrocarcinosis unless there is a concurrent stone formation. Causes in adults will include hyperparathyroidism, renal tubular acidosis, medullary sponge kidney, bone metastasis, chronic pyelonephritis, Cushing's syndrome, hyperthyroidism, malignancy, renal papillary necrosis, sarcoidosis, sickle cell anemia, and gout. Causes in infants and children. Furosemide therapy is the most common cause in premature infants. It is used for treatment of heart failure or bronchopulmonary dysplasia. It causes hypercalciuria, severe osteoporosis, steroid therapy, vitamin D excess also causes hypercalciuria, idiopathic hypercalcemia. Thank you for joining the class.